I'm Tamara Stuchlak, your host, and in this segment, we're speaking about the healing power of music. With us is Sheila Egan, a board-certified music therapist. Sheila, you've been pioneering music therapy at NIH for a number of years now, and you work with a team of doctors, nurses, and integrative holistic practitioners in a hospital setting, which is very unique. And you are completing a master's degree in music therapy from the Shenandoah Conservatory, and you also received your music therapy certification there. So let's talk about what you do with the patient, and maybe the pre in terms of coming up with a treatment protocol, and then maybe getting into the variety of techniques or what you do with patients.
Okay. Well, first I do an assessment of the patient. My first order of business is to find out if they're in pain, because if they're in pain, they can't pay attention to anything else. So if there's anything I can do to alleviate their pain, I will.
Such as?
Well, like toning, like Reiki, any hands-on technique I can do, playing music, doing guided imagery, visualization, anything to move them away from this pain cycle that they get into. And so that's my first order of business. Let's alleviate pain. A second order of business is what's going on emotionally with them. When someone is diagnosed with a terminal or chronic illness, it has a very deep emotional impact.
Ongoing.
Absolutely. And because music is about feeling, it's really nice to get in there to access those feelings, those emotions that maybe they're reticent to express.
And maybe easier to express than talk.
Gets right in there. It does. It gets right to the point. I'll say, pick a piece of music, your preferred music that you like to listen to, that expressing how you feel.
So you carry with you a whole range of music.
Oh, I have to have a little of everything. Yeah.
And you wheel it into the room.
I do. I wheel it right into the room. I got a big cart with lots of instruments and music overflowing, and I take it right in there. And and it's remarkable. It's absolutely remarkable what can happen in a session. I have a patient with osteogenesis imperfecta, and it's where your bones are brittle and they break. And I think she's broken about every bone in her body, and she's 21 now. And she's a long-term patient as well. She comes back every 6 months to be evaluated and treated. And she is quite a remarkable person because she says music has saved her life. Because of music, she gets up in front of audiences in casts, in sometimes quite a full body cast, and sings. And she's decided to go into, and she's done this.
Because of your work with her over the years.
Well,
and you're accessing.
I'm not going to take all the credit for it.
Right.
She started out as a singer when she was little, but I certainly encouraged her to keep going. And we actually did some recording together, and she makes recordings on a regular basis now and performs all over. She's actually performed for the First Lady.
Beautiful.
So she's a success story. She's studying music education and music therapy, and I'm very proud of her. Remarkable young woman.
So what does sound do? What physiological changes have been documented, have been studied? Let's set the facts straight.
I like this part. Okay, music has been documented to lower blood pressure. Singing specifically, when a person sings, there are new studies that say that singing releases nitric oxide in the body, which the body naturally makes, which increases the flow of blood. Good for heart attack, stroke, yada, yada. Good stuff. So when people are humming around the house or singing, it's good for them. It actually releases endorphins and, a host of other physiological changes. The thing that is difficult about our research is that it affects people differently. But I can go into the intensive care unit at NIH and play relaxation music and actually watch the monitors
go down. And you're called to the intensive care units.
Yeah.
You are called.
Yeah.
You are part of the team.
Right. Right. Yeah.
I think that would surprise people that music therapy is being used in that way. Let's talk a little bit about the conditions the whole host of conditions, whether it be in the literature or your work at NIH, that are very effective and used in music therapy, people's conditions. Is there a litany?
Yes. I can't think of any condition that music therapy wouldn't be effective for. I'll just put it like that because it's easier. There are things, and there are
Chronic pain,
chronic pain. I would do
nausea,
absolutely.
vomiting,
Yeah.
constipation.
Those are for toning. I do toning. This is a technique that I'm pioneering, so it's not widely used among music therapists, and I think it should be because it's so effective. I walk into a room, a kid is to his stomach from chemotherapy, laying there. Oh, I do 10 minutes of tone to his stomach. I tell him I'm going to sing to his tummy. They look at me like I'm nuts, and I don't care. And I do 10 minutes of this toning, and he sits up ready to play video games in 10 minutes. Whoa, that speaks for itself. And I have documentation and documentation and documentation of this. It's effective, it works.
Pre-surgery, cardiac catheterization,
Right.
mastectomy,
Yes.
stroke,
Yes.
labor and delivery.
Oh, labor and delivery is fun because you can do relaxation techniques, breathing techniques, visualization. There's a host of techniques for that.
So as a consumer, would you request a music therapist to come in and pay out of pocket? How would a person even approach
How would a
having
person do this?
music therapy in a
Well,
hospital setting?
I'll tell you, more and more hospitals are understanding that they will spend less by hiring these integrative therapists, that hospitalization time will be cut down, that
Length of stay.
medications will be cut, length of stay, medications will be cut.
Less side effects with less medication?
Side effects with less medication. More and more hospitals are realizing that these are cost effective, that these therapies are cost effective and frankly make for happier patients, and happier nursing staff if you have happier patients.
Are there specific conditions that music therapy should not be used for?
Well, I don't think music therapy in general. For toning, what I've found is that there are conditions that are contraindicated, and those are for new sutures. Not a good idea to be vibrating those around. What are the other things?
Infectious sites,
Infectious
blood
sites,
clots.
that's obvious. Oh, blood clots. Yeah, you don't want to mess around with those. You don't want to be in there moving things around if there's a blood clot. So it's just like acupuncture or hypnotherapy. There are, things that are contraindicated, and that's just a part of knowing what you're doing, basically.
How about vocal toning and these techniques that you are bringing forth in the field of music therapy? Can you show us, tell us, experiential?
Okay, experiential. Well, that one, the nausea was one. I'll stay away from some of the other stories. Let me give you two things. The vocal toning. For nausea, I haven't found anything that was more effective. Local pain, here's one. I had a patient who had literally a pain in his neck. He had thyroid cancer, but he had a pain in his neck that he couldn't get rid of. He had been to a chiropractor, he had tried acupuncture, he had tried everything. And I did several sessions of toning on this localized pain, gone. And I said, I want you to email me in 6 months. And tell me if it's still gone. And 6 months later, it never returned. Why? Because the vibration goes into the muscle tissue and vibrates and creates a relaxation response. That's why it works. There's lots of research on the relaxation response, and vibroacoustic chairs are something we use at NIH, and that is where the vibration of the music, actually it's the lower tones, creates a relaxation response in the patient. It works. And so this is the theory that I'm using for the vocal toning, or the vibroacoustics, the relaxation response, and there are some other music therapy terms that I won't go into. Now, what I'm going to do, Tamara, is that you've told me that you have some pain in the back of your neck. I'm going to put my hands on you, just very lightly, and I'm going to make a tone to this area. And what I want you to do is just see what happens, okay? All right.
So what I experienced was, from allergies and the pressure that normally comes, that tension comes to my neck. And when you were toning, the bones in my nose and bridge and face bones, I could feel that the tensions that's there that just comes as pain, releasing, so that it wasn't pain, it was relaxing pain. It was some soft vibration that I could feel those bones absorbing that sound, and very relaxing, going through the whole area.
And so how is the pain now?
Released, soft.
It doesn't take a lot. Just a little dab will do it. That's the best thing about it. And if a patient has some very difficult place, I'll do several treatments, and the body will have that relaxation response eventually.
What's interesting to me is maybe the contrast between what would happen if I rub these areas, which I normally do, and the difference between a completely, while that might be a little soothing, how completely relaxing and soothing, and what happened in the bones from that toning.
From
Very
the
different.
vibration. Yes.
Very different.
Yes.
Thank you.
You're welcome. I'm glad it worked.